And welcome back to Talk of Alabama. We are now joined by Dr. Kathleen McKeon, who's in studio talking about all kinds of interesting medical stuff. She's the newest member of the Andrews Sports Medicine team of physicians and specializing really in hand and wrist injuries. And wanted to say, at least, to begin with, you were a student and an athlete at Yale. And so you early on saw, I'm sure, plenty of injuries.
Yes, certainly I had teammates and friends who had all sorts of orthopedic injuries, and that's one of the reasons that drew me to the field.
Well, I was going to say your background. After you did that at Yale, you went to med school in St. Louis and completed your fellowship at Vanderbilt University. Why did you decide, after all of that and kind of being all over the country, to come here to Birmingham and join this team?
Well, I was actually born in Birmingham, although I grew up mostly in Atlanta, so I'm excited to be coming back to the South and sort of back to my roots and to be joining such a great practice. I'm really thrilled to be joining the Andrews Sports Medicine Orthopedic Center.
Well, we talk about hand and wrist, and it seems like for a long time there, you'd always hear about carpal tunnel, carpal tunnel. I don't see or hear about that as much anymore. Why is that?
I don't know. Carpal tunnel is incredibly common. It's one of the most common things that I take care of. Okay. We don't entirely understand what causes it, but there are some really great treatments available, ranging from wrist braces and other non-operative treatments to a carpal tunnel release, which is a surgery.
Okay.
That's typically very successful. The biggest problem with carpal tunnel is when people don't come to the doctor in time. So if you wait too long, there can be some permanent nerve damage, and the treatment options for that are really much more limited.
Well, speaking of injuries, you know as well as all of us that all you see these days, whether it be on the train, the bus, the park, people texting all the time and with their thumbs, is there really such a thing as texting thumb?
Sure. So texting thumb refers to pain at the base of the thumb or kind of on the thumb side of the wrist.
Okay.
It really can be from several different sources. So it can be tendinitis that we call de Quervain's tendinitis. That's kind of the technical name for it.
Okay.
Or it can be some arthritis or some joint strain at the base of the thumb. So if you are experiencing that type of pain, it's important to see somebody who can kind of figure out the underlying cause, because the treatment for arthritis is obviously very different than the treatment for a de Quervain's tendinitis.
So what would the solution be, though? Give up your phone?
Well, we wouldn't ask people to do that, but there's injections, there's bracing, there's some therapies that can teach you different techniques or different ways to use your thumbs that can all be very effective.
Okay, very nice. Or just, I guess, that texting where you can speak into the phone and it texts for you.
There you go.
So what do you think then, beyond carpal tunnel, besides texting thumb, what other things do you work on? What other things do you focus on and help people with?
I take care of pretty much any injury to the hand, wrist, upper extremity, anything from fractures to sports injuries, nerve damage. I do some microsurgery, so putting vessels and nerves back together. We do joint reconstruction, big variety.
And of the entire body, why did you decide to focus and specialize really in the hand and wrist area?
Hands are so vital to your everyday life. You use them when you are working, when you're taking care of your family, when you're doing any hobbies or sports that you enjoy. So being able to restore function to people's hands and give them back the ability to do those things is really very rewarding.
Okay, speaking of hands, so I crack my knuckles. Bad habit. I shouldn't do it, but I do. So does that mean I'm going to have arthritis when I'm old?
No, so that's kind of been lore passed down from your grandmother, but it's not actually been borne out in studies. There's no evidence that knuckle cracking causes any permanent problems. We do worry more if it's painful when you crack your knuckles. That can be a sign of something more concerning.
It feels good.
Yeah, that's fine. That's fine. Keep right on going.
Well, this is fascinating news for me. Okay, then I can just sit here all day. I do that, and it's horrible. I should, Okay, I was always worried that I would end up, like 90 and then have like hands like this from cracking.
No, not from cracking. Arthritis in the hand is very common, and that's something that we take care of a lot as well in all the joints of the hand.
AndrewCenters.com for more information and the phone number.
And the phone number is 939-3699.
Okay, so you can go there, go to the website, check her out. She's new to town. Give her a big welcome, a big Alabama welcome. We appreciate you being here.
Thank you.
We'll see you next time.